ask him to store the semen, not one sample, at least 5, 6 samples. Because with one sample we may not be able to achieve the pregnancy for the because we would have picked up at the age of 30, 31, 32. They would have married and they would have had the children. Suppose they don't have the children, then immediately we have to ask him to have the reproduction done by artificial insemination or IVF, so that before we start the chemotherapy, he will have his offspring. If that is not possible, if he is unmarried, then save the semen, ask him to store the semen, not one sample, at least 5, 6 samples. Because with one sample we may not be able to achieve the pregnancy for the wife.
Yes.
Because of so many reasons. So we must ask him to store as many samples as possible, at least 5 or 6, so that at least 1 or 2 children can be produced later on. Because the success rate of IUI and IVF are all limited to 18 to 28% only. So with one sample, we may not be able to get the required result. So he has to store the semen. So this is the one thing. And you asked me about the prognosis. Stage 1, excellent. We can assure him lifelong. This one, his age will be almost similar to any other person. Stage 2, about the half life cycle. This one is about 5 to 10 years. Stage 3, within 5 years. That is life expectancy with the treatment.
Therefore, it's so important we get a diagnosis early.
Yeah. Early diagnosis, the treatment is easy, cheap, and the outcome is excellent. Results are excellent.
So
That is, we can give almost 100% cure with this one.
So again, circling back for any viewers, male viewers who are listening to this, routine self-examination will be able to tell you whether when you've got some slight discomfort, when you're wearing tight wears, when you feel a little pain, when you're feeling dragging sensation in one of your testes. You should do a self-examination, feel it.
So,
and then the testes should be of the same size. And it should not be hard. It should be the consistency of the banana. If you have these symptoms, you should go to a doctor, get an ultrasound done. That's wonderful.
Banana, ripe banana, fruit banana, not...
Yes, got it. Okay.
And not very, very ripe, and this one. It should be, the consistency should be the one which we like to eat.
Yeah. Well, we all
and many times, the partner is the one who picks up. And many of my patients, couple patients, the partner has brought the husband for the examination. She will be the first person to feel that something is going on in his... During intercourse, she will be fuddling the testes, What, Jamie? She is the owner of penis and testis, She is the one who owns it, and she starts cuddling, and sometimes in oral sex, and even sometimes they put the testis into the mouth also. That is not only the oral sex of the penis, also of the scrotum. And she will be handling, and she is the one, that is, of course, those who are involved in oral sex, they are the ones who pick up easily. And the lady says, something is going on in your testis. One is little bigger and one is little harder. And another thing is, when she starts squeezing, the husband will shout. That itself is enough to tell that something is going wrong.
Right. So the sharp pain or something.
So we have to encourage the partner to keep an eye on the testis. Self-examination for the male, and for the partner, keep an eye on keep a palm on the testis. No, this is very practical. What I'm telling is quite practical, because you say, for example, breast cancers, breast tumors. It is a male partner who brings the wife for this one, telling that Dr. Saab, I am feeling something wrong with her testis, because breasts. Because we'll be cuddling during the foreplay, we'll be handling the breast, and suddenly one day he starts feeling that something is going wrong in one of the breasts, and he will immediately observe and tell the wife to undergo the examination, or he himself will bring the wife. Dr. Saab, something is going wrong. I feel that there is a mass or a nodule or a tumor in that. So it is usually the partners who observe the other partner more than anybody else. Anything, for example, any gait or even the jaundice or whatever it is, they say that, hey, something is going wrong. Why can't you go and get a medical examination done? So that should be an eye-opener. So we should always keep an eye on the partner also.
Okay. There's so much of medical advancement that happens
Yeah.
everywhere, every
Yeah.
month. Are there any recent
Yeah.
advancements in terms of testicular cancer that show?
Yeah, recently, so many markers have been identified to do the blood test, beta HCG test, and several other markers to pick up the tumors in the even before they have been diagnosed. But they are all in infant state, and secondly, they are all quite expensive. The common man cannot afford. They are all in the research stage only. Of course, in advanced countries, in annual checkups, they include these tumor markers, just like pap smear for the women. So these are all included, but it is still not yet fully established. And regarding the treatment is concerned, recently several developments have occurred in the chemotherapy and radiation therapy. And in the chemotherapy, several latest injections have been introduced. The curative rate is much higher than the earlier injections. So a lot of research, and April of every year has been declared as Testicular Tumor Month.
April.
April. Testicular Tumor Month. This is by the Urological Society. I think American or European, I don't remember. But they observe so that during that month, awareness campaigns will be done, that people get awareness of, just like we have lung awareness, the tobacco awareness, breast cancer awareness. So like that, this is also there.
Left untreated, how fast does testicular cancer progress?
I say first stage 1 to stage 2, it takes 2 to 3 years.
Okay.
Stage 2 to stage 3, it takes another 1 year. And once it goes to stage 3, it will be rampant. It is through the blood. The spread is through hemotic spread. So it goes to distant organs, right from toe to head. It may go and land up in any organ. The most preferred organs are lungs and brain. And once it reaches the brain, there will be all signs and symptoms of a brain tumor, and the prognosis is very bad. The life expectancy is less than 5 years.
Yes, sir.
Even with treatment. Yeah.
You mentioned earlier that genetics play a very big role in cancer. Could you elaborate more on that?
It is common to all other cancers, Most of the diseases will have some genetic origin, which we don't know. That's why so many genetic markers are being picked up, and genetic engineering is going on. Lot of intense research is going on in the field of genetics to find out the possibility of the diseases coming from the parents and the grandparents. That is the dominant genes, recessive genes carrying these things. It's all genetic engineering. Once we pick up which is the gene which is causing this one, through genetic engineering, that gene may be changed, the blood may be taken out, that gene may be removed, and it may be infused. That's all in the pipeline to come, maybe another 1 or 2 decades.
Are there any way that we can prevent or delay the onset of testicular cancer?
No, absolutely no, except self-examination. Because we don't know the etiology, and genetics we cannot change. Genetic origin we cannot change. And we don't know the factors affecting the tumor. So we are blind. The only thing is keep an eye open to see whether there is any change in the testis and go to the doctor as early as possible. And it is the duty of the doctor to examine thoroughly all the entire body, including the testis. And if he gets doubt, just get one ultrasound examination done. And as I told you, as a partner, to keep an eye on the balls of the partner.
You did mention that one of the marker that's seen in testicular cancer is undescended.
Yeah. Undescended. That is easily curable by removal of the testis, which is still lying in the abdomen and in the inguinal region. That is archidectomy. That can prevent the possible cancer.
Okay. So that's when the testis doesn't descend, and in layman's term, it's the ball which is not outside in the sac.
Exactly.
Right.
You will be having only one ball, or both the balls may be absent. Both the testis may be in the abdomen or in the inguinal region. In other words, empty scrotum. The scrotal sac will be empty.
Okay.
But they would have ran to the doctor much earlier, because they will have other secondary sexual characters absent, secondary sexual characters. So they would have landed up with a urologist or a doctor or a surgeon much earlier, because it will be annoying to them if both the testes are absent. In other words, if there are no balls, he will immediately run.
Yeah, the parents will pick it up first.
Parents would have picked it up much earlier. If one testis is there, they ignore. because they know usually parents will not go into the much details of examining the scrotum to find out whether both testes are there or not. Even if they notice that they feel shy to tell that one, and they'll have no resources to take to the doctor. They may think that that is normal, and they may ignore. Only when the boy reaches the age of 18 to 21, when he starts handling his testes, then he will immediately see that one of the testes is absent. Then he will immediately go to the doctor. Till then, he will not go.
Undescended testis is very easy to diagnose.
Yes.
Parents are the first ones to pick it
Yeah,
up.
yeah.
And if there's any
Yeah.
difficulty, then the young chap will also pick it up himself.
Yeah.
And this is fixed through surgery, correct?
Yeah.
Okay.
If it is if the undescended testis is quite big, and if it is in the lower end, that is in the inguinal region or in the inguinoscrotal region, it can be easily pulled and fixed to the scrotum. That is called as orchidoplexy. But if the testis is higher up in the abdomen, and if there is no cardia, that is that hanging tissue, that is spermatic cord, if it is not there, not developed, and if the testis is atrophied, very small, then there is no point in pulling it and fixing it to the scrotum. It won't work also. And it is not possible to fix up because the spermatic cord is absent or atrophied. Then it will be better to chop it off. That is remove it, orchidectomy. So the decision to do whether orchidoplexy or orchidectomy depends upon three things: where the testis is lying, how much it is developed, and whether that is cord is there, that is spermatic cord is there, whether we can pull it and fix it. If that spermatic cord is short and you cannot pull it, then it is not possible. If the testis is small, very small, atrophied, even if you fix it, won't work. Then no point in doing the orchidoplexy. If the testis is quite big and it is lower end of the inguinal region, then it is easy to fix it up.
Whenever somebody is going through testicular cancer treatment, what are the follow-up care and monitoring process that should happen in a routine basis?
Yeah, it's very important to see each center, each cancer hospital, and each oncogenic surgeon has its own protocol. So they will meticulously calculate all the risk factors, what stage it is. Apart from 3 stages I have told, there are sub stages also. 1A, 1B, 2A, 2B, 3A, B, like that. So, and they will fix up the markers where all it has gone, the possibilities and probabilities are spreading. Then they will follow how many course of chemotherapy is required, how many rats of radiation therapy is required. And during chemotherapy and radiation therapy, a lot of instructions will be given to the patient that is purely individual between the oncologist and the patient. In general, one thing I can tell you is follow the instructions given by your doctor. He will be the best person because he's treating.
Simple as that.
Because it's very, very specific. It may differ from one person to another person. We cannot generalize. If I tell something, it may not be applicable to a stage 1 person. And if he carries that in his mind, he will have trouble because, oh, doctor had told like that and this doctor is telling like this. So regarding specific treatment, best is follow the instructions given by the concerned specialist, because it's a super specialty, not a subspecialty.
That is awesome.
Oncology, yeah.
Any advice that you want to give our viewers?
Yeah, carry home messages, keep an eye on your balls.
Dr. Sharath, I cannot thank you enough.
Thank you, Jamie. It was so nice to be online with you. Thanks for the nice Zoom meeting. Thank you. Shubhratri. Good night.
Bye-bye, Dr. Sharath. Thank you for your time.
Bye.